John Anderson, does having stents in your arteries cause inaccurate calcium scores? Score was 483 in July. Score went up to 3910 in June of 2020. I'm not an expert on that specific topic. I will tell you a couple of things, though. Quite often we see a major increase in calcium, and it's associated with having an event, and it's often not a bad thing. And here's why. I had this with another patient this week. He said, "Doc, I had a calcium score of 300. I went on a low-carb diet, and then I went completely carnivore. I lost 50 pounds. My cardiologist told me I was killing myself with my carnivore diet." And I will tell you, this was carnivore with a little bit of dairy in there. Bottom line was, again, he lost 50 pounds by dropping his carbs. And I'm not concerned about it being carnivore. My perspective with him was, you're not killing yourself. Dropping those carbs, and especially dropping that poundage, that body fat, it's huge improvement in your life. You're not killing yourself, you're saving yourself. And he said, well, here's the other thing. He said, when I did that and I lost the 50 pounds, my calcium score went from 300 to 1300. And then I began to think, maybe my cardiologist was right. Now, if you did many CIMTs, and if your cardiologist did a whole lot of CIMTs, they would begin to understand a process that you can Google, do a fact check on me, you'll see it time and time again. Again, most docs are not aware of it. The reality is the risk is caused by soft plaque, inflamed plaque. And when you take plaque and you reverse that inflammation, you can shrink the plaque. Your cardiologists often don't believe that. Doctors often don't believe that. Yes, you can. Just look it up on something simple like Harvard Health and you'll see it. And we've got plenty of videos on that. But here's the key point that gets back to your question, John. When you go from soft, inflamed plaque to stabilized plaque, you increase your calcium score. You can increase it dramatically. And that was clearly my point to this individual. No, I don't think you increased your risk, even though you went from 300 to 1300. I see it all the time when people lose 30, 40, 50 pounds. Instead of getting a significant decrease in calcium score, they often get a major increase. And it was because they stabilized all that plaque. Does that mean you can never get a reverse in calcium score? It doesn't mean that. There's a fellow, and I'm blanking on his name. He's the guy in LA, I think, that's done a whole lot of work on calcium scores. He did a couple of articles about reversal of calcium scores. I've got a couple of patients that did videos on the reversal of calcium scores. John Lorscheider and Jerry Kurth both demonstrated reversal of calcium score. Well, does that mean they're getting worse? No. With both of these individuals, they were demonstrating significant improvement in lifestyle, 40-pound weight loss in one, 20 or 30-pound weight loss in another, significant improvements in other components of lifestyle as well, like carbs and things like that. Things aren't always as they seem.
Continue to get great feedback regarding the webinars, and here's why. On the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CIMT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.